Welcome to the Topic of the Month with Kim Wardlow, an AINC original podcast. It's not easy being blind or going through vision loss, but we'll help you navigate these waters. Press on. Push forward. You've got this.
Hello and welcome to the Topic of the Month, brought to you by the Audio Information Network of Colorado. I'm Kim Wardlow, your host, the Executive Director here at AINC. And thank you for joining us today. We're continuing on with our topic this month of February is transportation. And today we'll be talking with Angel Bond, who is the Boulder County Mobility for All Program Manager. And we'll be talking to her about different options for transportation and some of the pros and cons of different transportation options and how you can get assistance if you're in Boulder County or other mobility councils in other areas that might also be able to assist you. So when we return, we'll be right back and we'll talk with Angel.
This is Topic of the Month with Kim Wardlow. If you enjoy what you hear, please visit AIN Colorado for more shows, news, and articles read by our amazing staff and volunteers. If you have a question for Kim or would like to recommend a guest for future shows, please visit aincolorado.org/podcast-guest. Thanks for listening and enjoy.
Hello, Angel. Thank you for joining me today. It's been a while, I think, since I've seen you in person. It was when it was warm out, so it's good to see you virtually today.
Yeah, great. Thank you, Kim, for having me. I'm looking forward to the discussion.
Well, before we dive into transportation, I always like to ask guests just to share a little bit about themselves so our listeners can get to know you a little bit better, or if you have some, fun or interesting fact about yourself. I know in your pre-interview, you were talking a little bit about your time in the Army, and that was kind of interesting and maybe something that people typically wouldn't know about you.
Yeah, great. Thank you. So I live in Westminster. I'm originally from Oregon. I took a long path to get here to Colorado. As you mentioned, I was in the Army for almost 13 years. During that time, I worked as a Russian linguist. Primarily for 6 years of that, I did arms control. So I worked as a diplomat, working with the former Soviet Union countries. And I like to say that essentially I'm doing some of the same things that I did in the Army, in that I'm bringing together diverse interests to achieve a common objective. And that's really around transportation coordination. So for the past 9 years or so, I've been working in the field of transportation coordination and mobility programs. And that's just kind of where I've landed and found my passion after the Army.
Well, that's great. Well, we're neighbors. I live in Westminster as well. So,
oh, that's great. We'll have to get together for coffee sometime.
Yeah, that would be great. So I know you haven't been in Boulder County for those years. Were you in Colorado Springs before that?
Yes, I was. So I really started getting into transportation when I was in grad school. I went to UCCS, University of Colorado, Colorado Springs, where I was studying public policy. It was the Master's of Public Administration program. During that time, I got a fellowship that was intended for veterans to be able to find like a second career, a new passion. And I worked with the local transit agency in Colorado Springs called Mountain Metro Transit. I worked there for just a short period of time, and during that time, I found out about an opportunity to work as the mobility manager for the Pikes Peak Area Council of Governments. That's kind of a long, wonky term, but basically each major urbanized area has a planning organization, and Pikes Peak Area Council of Governments was the planning organization for the Pikes Peak region. I worked there for about 2 years doing similar work, transportation coordination. It was a little bit different in that the focus was more on coordinating human services transportation providers, like via mobility services. There were several different ones down in Colorado Springs that I worked with coordinating. And then during that time, I found out about the mobility program in Boulder County, and I started working in Boulder County in 2015. So I've been the Mobility for All program manager since then, but the program has definitely changed and grown and went in different directions since then. So it's been a great growth opportunity for me.
Well, that's great. So can you tell our listeners a little bit about the program here in Boulder? I mean, I realize it's different in different areas. I know last week we had Colleen Samuels from Dr. Mack on, so they have their program, but could you tell us a little bit about the program here in Boulder?
Yeah. So both Dr. Mack, which is the Denver Regional Mobility and Access Council, and Mobility for All are programs that are called mobility management. And basically the federal government funds a bunch of different transportation options, from aging services to disability services, Medicaid, Federal Transit Administration. And in the early 2000s, they realized that these different organizations kind of operated in silos and nobody was really talking to each other as much as what they should. So they created this concept of mobility management, which is a human-centered approach to coordinating transportation. At the basic level, it's information sharing between different funding streams and different organizations that are in different sectors. So Dr. Mack, they provide the regional coordinating council at facilitation, which means that at the regional level, they bring together stakeholders from those different funding streams that work on transportation access. And they try to coordinate transportation gaps and address information silos. And then here at the local level, we facilitate what's called a local coordinating council. And we call ours the Boulder County Mobility and Access Coalition. And it's a coalition of approximately 30 organizations that really work together to collaboratively address transportation gaps. And that's really from a human-centered standpoint. So historically, there's been kind of a bridge or a silo between the human services and transportation planning and providers. Mm-hmm. So the planners didn't really talk to the human services organizations, and transportation providers didn't talk to the human services organizations as much as what they could have. And so the human services organizations, they really find out the needs of the people that they're serving, because they're serving them to get food access or healthcare access or whatever that purpose is of that human services organization. So we really try to bridge those two fields, transportation planning and providing providers, and then human services, so that hopefully we end up with a more equitable, affordable, and accessible transportation system for all underserved folks. So we're really looking primarily at older adults, individuals with disabilities, low-income households, youth, veterans, pretty much anybody that the standard transportation system does not work for.
And are there local coordinating councils in different parts of the state? Is it only in the metropolitan areas, or are there councils in more rural areas that include more rural areas as well?
There are. It's not uniform, right? So I can't say that every county has their own coordinating council. There's definitely the Northwest Area Council of Governments. They have a regional coordinating council that coordinates between 7 different counties, perhaps. And there's definitely ones in different pockets. Really, mobility management was initially funded using specific grant funds. Mm-hmm. So really it was which organizations had the need to coordinate across sectors and really took advantage of those grant funds. So I would say here in our region, there's 2 up in North Front Range Metropolitan Planning Organization. So there's the Weld County Coordination Council and the Larimer County Coordination Council. And then for us, we're the Mobility and Access Coalition for Boulder County. And then in the Denver metro region, I would say that to varying degrees, there is at least a point person in each of the counties of the Denver metro that works on transportation coordination. There are different levels of activity, I would say, with different LCCs. But if you want to know if your county has a local coordinating council, I think Dr. Mack would be a great organization to reach out to, because they do some capacity building, for some of the local coordinating councils. So they help support them by taking meeting minutes and really helping provide some guidance and vision.
Great. Well, thank you for that information. Since we do have folks from all over the state that listen, I don't want to leave anyone out, although I know a lot of the public transportation does get centered around the metropolitan areas. I know when you were talking with Jonathan, you told him a little bit about if somebody were to contact you, what would that look like? What would that experience be? And I'm wondering if you could share that with the listeners too, of what they would expect if they were to contact your office with questions, or because I know you're not actually coordinating rides for people, but you are helping them with information.
Yeah, that's right. So really with that MAC, that Mobility and Access Coalition, we identify gaps and barriers and points of coordination that need to happen in the community. But then to take it the next step, we basically share information. So we do information and referral services. We call it transportation assistance. So people will call us and they will ask us if there's a transportation option to get to a particular location, right? So oftentimes it'll be something like, my mother has a colonoscopy. I can't give her a ride. Is there anything available? Usually if it's colonoscopies, I would say no, because that's a really challenging one to provide transportation for, because providers just don't want to take that liability of signing somebody out after a post-op procedure. But oftentimes it's us collecting information about their location, the time that they need to travel, their demographics that might impact the transportation options. And we kind of go through all of the options that could be applicable to them. So for example, if somebody's doing a city-to-city trip, we would first check to see if they were an older adult or an individual with a disability. And then we would refer them to the organization that could best suit their needs. So if somebody doesn't have a mobility limitation that would prohibit them from using the fixed route bus, then, but they still, they don't necessarily know how to use the bus, then we might refer them to Dr. Mack to do some travel training. Really, I would say the first option that we always look to is public transit, because that's going to have the most frequent service and it's going to be the most affordable if you have it available. And there are other considerations, right? Some people don't feel like they can navigate public transit. So then we would help connect people with transportation resources to teach people how to use the bus. If somebody has a disability that prohibits them from getting to the fixed route bus, then we would refer them to RTD to get signed up for Access-a-Ride. Sometimes people don't live within the Access-a-Ride service areas, and if they're an older adult or an individual with a disability, we would refer them to VIA. So we just kind of, that's not an exhaustive list of transportation options, but we would really just try to find out what are their transportation needs, like how urgent are they, what are those barriers that they're faced with, and then try to customize a personal, individualized travel plan for them. Sometimes if there's not VIA mobility services or Access-a-Ride available, we'll help connect people with Uber or Lyft or GoGo grandparent credits to get to where they need to go, depending on the hours, right, and their technology ability. During the update of our transportation master plan, we held a lot of focus groups and community conversations with older adults and individuals with disabilities, and primarily Spanish speakers, to find out what needs were in the community. And what we heard a lot were that people might not feel comfortable using smartphones to access transportation options. So we have branched out to develop some workshops to help people feel more comfortable using apps to access transportation. But we offer those through partnerships typically. So if a senior center wants to offer a workshop like that, then we would partner with them and help people understand how to use Uber or how to use Lyft to access their transportation needs. So it's just kind of a snapshot. It really just depends on what the need is, and we try to customize what's available to meet their needs, try to customize the approach.
And have you found or heard from consumers' specific needs related to individuals that have vision loss. I know you were doing some work with the Center for People with Disabilities around vision loss, and I think that may have been more in providing training, but I know you were trying to get some specific feedback from individuals that had vision loss.
Yeah, so right now we're hosting an inclusive planning process. And when I say inclusive planning, what that really just means is I want to hear from people who use the system, right? I want to hear from people who could benefit from expanded transportation access. And we are partnering with the Beyond Vision group at Center for People with Disabilities. And we have a number, probably about 4 to 6 individuals who identify as having low vision or are blind, and they're providing us feedback on the different apps that we're using. So we are definitely not accessibility experts when it comes to screen readers or anything like that, but they know their experience, right? The Center for People with Disabilities, they know the experience of the people that they serve. So just in general, having us have a better understanding of what the barriers really are for individuals with low vision or blindness is really helpful, because we can't just like assume that if we share a video with somebody that they're gonna that it's gonna be like speaking the same language, right? I mean, because screen reading language is not the same as like for sighted folks, like when they're trying to download an app. So really trying to right now, just in that listening phase, we go through with the it's basically a little mini focus group. We go through with the focus group and tell them what we typically tell folks, and then ask for feedback on how it can be more inclusive and how we can approach it from a more accessible standpoint. So it's been a great learning experience, and just in general, trying to understand people's experiences with Uber and Lyft. I would say that a lot of low vision and blind folks have really great technology experience, at least the ones that are in the workshop and providing us feedback. And they've been able to like teach us a lot about the phones and just the capabilities of like accessible formatting or accessibility features on a smartphone are just, they blow me away. It's just amazing. I know that can probably be really intimidating for a lot of folks. So I don't want to assume that everybody like knows how to use those accessibility features to that extent. But it's just great to see that Beyond Vision and other partners are really helping people access transportation and access information using more accessible methods.
Right, because those partners like CPWD are providing the training to the people on the technology.
So they do in general, like they have a Beyond Vision working group, a peer group that they provide just a screen reader training. They don't necessarily provide the transportation training, but
right.
We're learning from them how we can best provide the transportation training. And most likely it'll be more of a one-on-one situation, just because for transportation, everybody's situation is so unique. And then also from a low vision blind standpoint, everybody's situation is just so unique that it would be hard to do like a large group, like workshop presentation. So at least right now, what we're learning from the feedback that the community conversations, the inclusive planning group are providing us, it's probably best to have an individualized approach and do like one-on-one peer mentorship or something along those lines. Just because like when you compound the uniqueness of transportation needs on top of the uniqueness of accessibility needs and what people's comfort level is, it just gets very difficult to tailor a workshop that meets everybody's needs.
Right. Well, and I would think a person that is using a cane versus a person that has a guide dog, that experience might be different as well. I don't know if you've had any feedback on that from folks who use guide dogs.
So Jonathan and I, we talked about this a little bit around Uber and Lyft and just in general. I obviously have not experienced this myself, but in general, I've heard that some of the Uber and Lyft drivers do not want to take guide dogs, which can be a challenge because by the ADA standards, they are supposed to allow guide dogs with people in the vehicles. I think that there's not as much awareness among Uber and Lyft drivers of the ADA. So that's another reason why one of my first places that I go is to refer people to Access-a-Ride or to Via Mobility Services, because I know that the drivers of those organizations have went through training on the ADA, the Americans with Disability Act, and they know what the standards are, and they go through passenger assistance training, right, to be able to be respectful of individuals' disabilities and really be able to provide the best service that they can. I'm sure that there are varying levels of ability for those drivers to provide dedicated assistance to folks, but on the whole, I would say it's probably a better quality of assistance, and they understand where people with disabilities are coming from a little bit better than the average Uber and Lyft driver. But that's just what I've heard. I'm just basing this off of experience that people have provided us feedback on.
Right.
The Uber and Lyft options are great for like short notice trips, whereas Via and Access-a-Ride can't really accommodate those short notice trips, which can be challenging.
Yeah, and maybe we can talk about that a little bit as well. And another point before I lose that thought is I know you had mentioned too that Lyft and Uber say that they're technology companies, not transportation companies, and therefore aren't required to meet the ADA compliance, which I found really interesting. I did not know.
Yeah, that's been their stance in some of the legal situations. I'm not an expert in law, and I'm definitely not an expert in like technology versus transportation providers. But generally speaking, they have insisted that they're technology companies, and therefore, if they make their apps accessible, they're doing what they need to do to meet the Americans with Disability Act. For example, if you are a transportation provider, you still have to accommodate people in wheelchairs, right? And so you have to have a certain number, a reasonable number of vehicles that are wheelchair accessible. So that's why you have organizations like Z-Trip, which is a private taxi company that has wheelchair accessible vehicles. We can definitely argue if it's enough or not, but they still have that capability of being able to provide it. Whereas Uber and Lyft don't universally have those available. Hopefully with some policy changes, they'll become more and more prevalent. Some local jurisdictions will require that a certain percentage of Uber and Lyft vehicles be accessible for wheelchairs. But that has to be like a legal requirement in order to get approval to operate within those cities. I don't believe that we have anything like that here in Colorado. We've definitely talked about possibly setting aside like a fund from some of the user fees to see if we could have a pool of money that transportation providers could borrow from to purchase wheelchair accessible vehicles. But honestly, that's not like my area of expertise. Right. So I could probably find some more information for you. But we still have a long way to go here in Colorado for wheelchair accessible transportation on demand.
What about other pros and cons? I mean, you've mentioned some. Obviously, public transportation tends to be less expensive, but an Uber or a Lyft is very on demand, and assuming they do stop and pick you up, that, you know, you don't have to schedule it in advance. What are some of those pros and cons that people should think about if they're trying to plan a trip?
Yeah. So we always try to advise people to figure out multiple ways to get places, because there's going to be pros and cons of any option that you have. We try to look at it from like an opportunity cost standpoint, right? So if you take an Uber or a Lyft, you could get there faster than taking the bus. You could get a more like curb to curb service. So it's a more personalized service, but it's going to cost you a lot more, and it might be unsustainable for all of your transportation needs. If you take public transit, you might have to accommodate when you want to go. You might have to wait another half hour in order to get in order to take the bus where you need to go. And if you, depending on where you live, if you live close enough to a fixed route, that could be a pretty direct route that's pretty affordable. It's more affordable. But if you have to take any transfers, it gets a little bit more complicated. And then you're working on you're working on coordinating two different buses, there's apps that can help eliminate some of that coordination so it's not as intimidating. But if one of the buses is late or you miss your connection, that can be really challenging, especially if you're in areas where there's not a ton of transit service. So some places of the region, the buses come every hour or every half hour. And that's just that's not frequently enough to be able to coordinate for some people. Because if you miss one bus, you're stuck somewhere for another half hour, at least if the bus comes every half hour, right? Mm-hmm. So really what we try to do is we try to first have people go see what bus is available, see if it is like an easy bus to make, easy trip to make on the bus. And then go to see how much it would cost to take that in an Uber or Lyft. And then really kind of see like what that opportunity cost is. If you're paying $3 for a bus trip and you can afford that, but it takes you 3 times as long to get there by bus versus Uber or Lyft, do you have any extra funds to be able to cover the Uber or Lyft to get there a little bit quicker? Also, by knowing how to do multiple modes of transportation, if one of those modes fails, you have a backup option, right? So if you did live someplace where there is a bus that comes every hour, if you missed that one connection and you had an Uber or Lyft account, you could take a shorter Uber or Lyft. You wouldn't have to take that whole distance, right? You wouldn't have to pay all the way from downtown Longmont to downtown Denver. So that could provide a little bit more flexibility for folks. I mean, I think just in general, knowing that where you live also impacts the number of drivers that are available from Uber and Lyft. That's something that people don't always think of as well, right? Just because Uber and Lyft are present most of the time in your area, if they're not getting a lot of requests for trips, you might have to wait a long time for an Uber or Lyft to come get you as well. So just trying to build that resiliency and experience with different modes of transportation and understanding that there's flexibility. You could take an Uber or Lyft to major park and ride and then take the fixed route bus from the park and ride to downtown Denver or downtown Boulder. That way you have a little bit more flexibility. And usually for major park and rides, they have more frequent bus service. I do want to mention that in the RTD service area, if somebody is an Access-a-Ride customer, and that means that they aren't able to get to the fixed route bus to use it, but they live within 3/4 of a mile. That's kind of a really technical, wonky definition, but it's what the Federal Transit Administration requires for complimentary ADA. So if somebody lives within 3/4 of a mile of a fixed route, but they can't get to that fixed route because of mobility limitations or cognitively they don't feel comfortable transferring, then they can qualify for RTD's Access-a-Ride. The one cool thing that is going on right now is that RTD's piloting an access on demand program where Access-a-Ride customers can access Uber on demand, and RTD will cover the first $20 or $25 of that trip. They used to do a cost sharing where the customer would pay for the first $2 and then RTD would cover up to like $20. But now they've changed it to where the first $20 or $25 will be covered by RTD. And then if you go on a longer trip, then you would cover the difference between what RTD covers and what the total cost is. So that can provide an additional layer of flexibility for folks who are unable to use RTD's fixed route bus system. So they would have Access-a-Ride available and also Uber on demand, which would be great if somebody could use it because they don't need wheelchair accessible vehicles.
Right. And then they would need to be aware if they were, because Lyft and Uber have peak hours. Like it's also like when you travel can be a determinant, not necessarily for a fixed route bus, but for something like Uber or Lyft.
Yeah, that is something that's really important to keep in mind. And the reason why the technology network companies do that is they try to get more drivers out on the road when there's peak hours. So if they raise the rates that the drivers can get, then more drivers will be hopefully willing to drive during that time until it stabilizes the demand, like with the demand. So That is something that's hard to predict, right? Like when peak hours are. And that's particularly challenging after the pandemic because peak hours have changed a little bit, right? Now that you have more people that can work remotely during the day sometimes, and we're seeing a little bit later peak time and a little bit longer peak time. So it's no longer like that, actually more like 7 to 9 used to be kind of peak hours. Now we're seeing more like 8 to 11 or something like that. It just depends, but yeah.
Right. And what about geographic barriers for services? And, again, comparing the different types, whether you're in a fixed route bus or service like Via, can you cross county line? Or how does funding affect that and different services and different groups of where they can travel?
Yeah, that is an excellent point. So currently, VIA does have limited service that's called town-to-town service. And I'll have to pull it up to be able to speak to that a little bit better. But there's only certain days of the week that they go between Boulder and Longmont, let's say. And it's really challenging to get a cross-county transportation connection. Hopefully that'll be changing because VIA does provide service in like Denver County now, Jefferson County, and Adams County. So hopefully at some point they would be able to do those cross-county trips, but it's going to be a little bit more challenging based on the funding sources that they get. So the funding source that they get for Boulder County is for Boulder County residents. So they get funding from the Area Agency on Aging, which is Boulder County centric. They get money for the Federal Transit Administration, or from the Federal Transit Administration, that's for the small urbanized areas in Boulder County. Whereas for Denver and those other funding areas, they get it from DRCOG, which is the Area Agency on Aging for the large urbanized area. And then it's also the Federal Transit Administration dollars for 5310, which is kind of a technical term, but for older adults and people with disabilities also goes through DRCOG for that particular large urbanized area. So it can be super challenging. Let me go ahead and read this off. So between Boulder and Longmont, VIA goes Monday, Wednesdays, and Fridays. Between Longmont and Lafayette, they only go on Tuesdays. Between Boulder and Southeast Boulder County, so that's Louisville and Lafayette, they just go on Wednesdays and Fridays. And from Lyons to Longmont, they only go on Tuesdays. So that can be really challenging for people to like try to get their doctor's appointments scheduled when VIA does town to town. But if you are certified for Access-a-Ride, they have to operate anytime the fixed route buses operate. So that means that instead of having to fit your trips between 8 and 4:30 and those town-to-town trips that VIA has, you could get a trip from anywhere in the RTD service area that's 3/4 of a mile from the fixed route bus to anywhere else. So you could go from Longmont to Aurora, and you wouldn't necessarily have to worry about what day of the week it is, as long as you went during those service hours when the fixed route bus was operating. So I guess in general, what I see is sometimes VIA is easier for people to sign up for. So they'll sign up for VIA, but then they're artificially limiting their mobility because then they can only travel when VIA operates, which is limited because they're a nonprofit, right?
Right.
Instead of signing up for both, like I would recommend anybody, if you qualify for Access-a-Ride, also sign up for VIA. That way you have those backup options, right? Because if you can qualify for Access-a-Ride, it takes longer to sign up and takes longer to get certified for the service. But you can go anytime the fixed route bus is operating, and it's a civil rights service, which means that it's more tightly regulated. And you can call 24 hours in advance and be guaranteed a certain window of when they can meet your transportation needs. So I think it's worth like signing up, going through the process and the extra bureaucracy. But yeah,
it sounds like it's good to have more options are better.
Yeah, for sure. And then also like Access-a-Ride, if you have fixed route bus service that operates in your area on the weekends, you would have weekend service, right? And so usually fixed route buses, they operate from like 7 to 8, depending on where it is at. But that means that you would have accessorized service on the weekends from 7 to 8 p.m., right? And so I don't know, that could be, it's easy to go with the simplest option, but I always try to advise people to sign up for as many options as possible. That way you always can have something available.
So, Angel, could you talk a little bit about transportation when there's an emergency situation? Like if there's a notification of a fire and people need to evacuate, because obviously that's a concern for anyone, but for an individual with vision loss or other disabilities or challenges, there might be other factors that they really need to think about ahead of time because they're not going to be able to just jump in their car and go.
Yeah, that's really important. So there is something called the Boulder Office of Emergency Management. So this is an office that is staffed with the City of Boulder staff and also Boulder County staff. So in the event of an emergency, we are all activated. Different areas of service are activated to work together. So our team, so Boulder Transportation Planning and the City of Boulder Transportation Planning folks, we get activated for what's called Emergency Support Function number 1, which is transportation evacuation. So for example, with the Marshall Fire, when we were activated, we immediately called all the transportation providers that are in Boulder County. So we contacted RTD, Via Mobility Services, the school buses, Green Ride, right? And so we let everybody know that we were activated and that we may need their support. When people contact the Office of Emergency Management and let people know that they need help with evacuation, we would send somebody like Via to go pick people up from their facility. We can't guarantee that they would always be able to have Via, but we would be able to coordinate to the best of our ability the evacuation. So we worked with Via and Green Ride and all those folks, and we were able to evacuate a lot of people who were homebound during the last Marshall Fire. The OEM, Boulder OEM, is on Twitter and it's also on Facebook. So I would recommend that if you're on those social media platforms, to search for Boulder OEM, so it's Office of Emergency Management, and sign up or follow them. You can also call them in order to get instructions on how to sign up for Everbridge is what it is. So ahead of time, you can sign up for Everbridge and then you'll get a text notification whenever there's an emergency that they've declared. So their phone number here is, let me saw it. So it's 303-441-3390. Again, that's 303-441-3390. And you can ask them how to sign up for an emergency notification. They do not necessarily take a list of people who would need to be evacuated, because then we would probably spend more time trying to track people down in an emergency, and we might waste very valuable time and resources to get people evacuated. So when there is an emergency, people of the public would get the notification from the Office of Emergency Management, and then they would let us know that there's somebody at one particular address that needs help with evacuation. So Via Mobility Services was a huge partner in the Marshall Fire and a lot of the other natural disasters, unfortunately, that we've had to deal with. But they've always been a really great community asset, and they've been able to take people either to other assisted living facilities or to an evacuation center like at the YMCA, and really try to help people get to where they need to go in the case of an emergency.
Well, thank you. That's really helpful information. I think when we talk about transportation, we mostly are focusing on what is needed day to day, but when those crises happen, it's good to know and know ahead of time, have a plan for what you're going to do. So that's really helpful information. And then for anyone who is in Boulder County and is interested in participating, I know you all have monthly meetings of your coordinating council. How would they go about participating in those meetings?
So if they do want to join the Boulder County Mobility and Access Coalition, they can register for our meetings at boco.org/MAC meetings. And that will bring them to a Zoom link. We do meet virtually most of the time. Sometimes we'll do in person for strategic planning meetings, but it's a great way to listen in to the transportation conversation. And again, that's BOCO or Boulder County, BOCO.org/MAC meetings. And then people can go ahead and register for those and attend them on a monthly basis. If they're outside of Boulder County and want to get involved in their own community, I would reach out to Dr. Mack. Dr. Mack is the Denver Regional Mobility and Access Council, and they basically have information on their website about all the other local coordinating councils, is what they're called. So we're always looking for more people to get involved in transportation planning. It's really important for people to be able to voice their lived experience and be able to frame what programs are going to get implemented and what strategies we focus on. You can also call Dr. Mack at 303-243-3113. Again, that's 303-243-3113. And that's their information and assistance line. So they also do information and assistance for transportation options all over the Denver metro region. So you could call them and ask for options as well. You can reach Mobility for All at 720-564-2218. Again, that's 720-564-2218. Or you can email us at mobilityforall@bouldercounty.org. And that's all lowercase, mobilityforall@bouldercounty.org.
Great. Well, thank you so much, Angel. This is just so much information. And it's so important. Obviously, transportation impacts everyone's day-to-day lives. We're always on the go. And sometimes I think out west, it's a little more challenging with our public transportation. Everything's a little more spread out and maybe not as easy as some of the more coastal centers and trying to travel there where there's subways and buses and trains and so many options. So having that assistance for folks is so important. So I really appreciate you sharing your knowledge today with us.
Yeah, no problem. Definitely reach out if you have any other transportation issues or questions. It is really important. Transportation is essential. It's a linchpin service to accessing all other aspects of your life. And if you don't have a backup option or you can't drive a car, it's really hard to get around. Unfortunately, too many policymakers, they primarily just drive, and so they don't think about the other options or the other things that people need to be able to get around, the other supports and services. But just thank you for raising awareness of transportation.
Thanks, Juan. Thank you all for listening today to our podcast. We hope that it's been informative for you. I always promote our other podcasts, After Sight and Blind Sight. And in March, we're going to be starting Blind Level Tech. So we've had lots of requests for information regarding technology. So that podcast is going to be launching here in March. You can find out more information through our website at aincolorado.org for podcasts, for any upcoming events. Certainly, if you would like to donate, we always appreciate that as well. Donations helped us to be able to continue to provide these services free of charge to our listeners. So we appreciate all of you listening and hope you'll be back with us next week for more information on transportation. Thanks.